hearing about that. A couple of updates. Just wanted to highlight, first of all, as many of you are aware, the public health emergency is expired as of last Thursday. As you know, this was basically an authority expiration. The disease is still around at many levels. But you do know that authority changes a lot of issues. We in many ways went from what was a single payer universal health care process for this one disease to our usual systems of care. So there are changes in who's paying for vaccinations, who's paying for testing, authority around data, issues around that we strung onto the emergency, like Title 42 and immigration policy. So there will be some changes, obviously, as we go through this, and there'll be some bumps that'll be ironed out. Just want to assure you that the Alliance and APHA are still committed to working with the administration and Congress to address all of these things as we go through this transition. Secondly, as I think most of you know, Dr. Walensky has decided to step down at the end of June. And we'll obviously be following that very closely, and have already made a commitment to CDC to help them and the administration, anything that we can do as part of that transition to the new director. And finally, I've got a report that I want to share with you. It's a report from the President's Council of Advisors of Science and Technology, in which I sat on as a member of a subcommittee around public health. So if we could go, I think a slide or two. Yep, the next slide. And this is a report that was released on May 2023 and voted in the affirmative by the President's Council, and then, of course, passed on to the President. If we go to that next slide. It basically had three recommendations. The first recommendation was to kind of really establish a common lexicon and standard classification for the public health workforce. As you know, we really don't have a real standard of what a public health worker is. I mean, there are many of us trained in a whole range of disciplines, but an epidemiologist may or may not be a public health worker. A statistician may or may not be a public health worker. A person, working in emergency preparedness or health education may or may not be a public health worker based on where they work, not necessarily based on how they're trained. So the way that the Department of Labor handles that is puts together called a SOC, or a Standard Occupational Classification. What they do is they bring together skill sets and training and correlate that by where you work. And then that defines your working environment. And once you put a SOC together through the process that they go through, you can actually then count and enumerate on an ongoing basis how many workers you have in the field of people doing a particular kind of work. And so the first recommendation we came up with was to recommend that the Department of Labor Statistics, OMB, and working with HHS primarily, come up with a SOC for public health workers. And once they do that, then on an ongoing basis, they'll be able to, either they or private sector entities can enumerate the number of public health workers. As you know, we kind of have a guesstimate out there. A back of the envelope number of 500,000 workers has been kind of the number we've worked with for many years. So we think that's an important first recommendation. Go to the next slide. So recommendation number 2 was to actually help build the public health workforce. And there were 2 sub-recommendations there to really set up a recruitment campaign to fill jobs, both at the federal level and the local level, and to work with local states and local governments to try to move some of the barriers out of the way to getting workers. And that means making sure that there's funding to train public health workers. As you know, we already have some scholarship and loan repayment programs to fund and support public health workers, but it needs to be expanded. That's particularly important for preventive medicine docs who, when they're not on a clinical rotation, there really isn't any funding for them, and they're funded separately through HRSA to make sure that happens. And we call for an expansion of those programs. So hopefully in future presidential budgets, we will see an expansion of support for those kinds of things. And looking for a whole range of new pathways and exchanges to work between the locals and the feds so that we can build a dynamic group of people at the federal level who have local experience, and at the local level who have federal experience, by looking at more exchange programs to help build that workforce up. And then finally, the third recommendation was a recommendation around equity and engaging communities. So you can go to that next slide. And that was very much talking about building that capacity. And there were two sub-recommendations for that. And part of that is getting the Department of Labor and HHS to look at community health workers and figuring out how best to utilize community health workers because they're from the community, and to build a career path so those community health workers can actually become maybe in many cases entry jobs for the public health field, and then have them ways for them to move up in the system over time, so that of course what you would do is expand the number of people that know the community and know the hood, so to speak, that can foster improved relationships with communities and trust in those communities. And, and also to build a national community of practice that is focused on scientifically informed, community engages programs on health equity. So using the science that we know works to advance equity in the workplace, particularly through public health agencies. Next slide. So with that, let me stop, and I will turn that over to Angie.
Thanks so much. We just wanted to tell you about a couple other things that are going on over the next month or two, where the Alliance will be present, and so would love to see you all if you're there. First, we'll be at Grantmakers and Health at the annual conference, June 7th to 9th. We have a presentation on the 8th where we're really going to have a chance to share some of what we've learned around building our robust, equitable, resilient public health system. Our presentations, I think, at 2:30 Central Time that day, but please join us if you're there. We'd love to have a chance to interact with all of you all. Our Policy Action Institute for APHA is June 15th to 16th. It will have national issues the first day, and then a focus on advocacy the second day, which is something we think is really important. I see also CSTE is June 25th to 29th, so feel free to join them there. And then also HO 360 is June 10th to 13th, and I know Raya will be there, but many of our partners also will be at that meeting. So hopefully people can have a chance to get together. If you'll go to the next slide, please. We are really excited today, as Dr. B mentioned, to have a chance to learn from our colleagues from Kaiser Permanente and those partners they're working with about this new initiative that Kaiser's launched to support a safer future with public health, and to learn how they hope to work with partners to build health. And so I will introduce Dana, and then she will take it from there and moderate the group. So Dana is the lead for public health infrastructure in the Office of Community Health at Kaiser. She leads a portfolio of work around public health infrastructure and creating the foundation needed to ensure our public health system can support equitable health outcomes for communities as they're prepared for future health emergencies. She has done many other exciting things, including working at the intersection of public health and healthcare, working as a health educator, managing a $1 million healthy eating active living initiative, working with Kaiser's Northern and others. So tons of experience, and I will let her take it from here. So thanks so much to all of you all for joining us. And then at the end, as always, we'll have time really to learn. I know all the partners were interested in learning from all of you all also, things they should be thinking about as they get started or ways that we can connect. So with that, I will hand it to Dana. Thanks so much.
Thank you, Angie. Hello, everybody. It's great to be here. I am relatively new to this group. I think the last meeting was maybe the first one I joined, but I'm thrilled to be here today to share a little bit more about the work that Kaiser Permanente is doing to help build support for public health. And I'm also thrilled to be joined by the wonderful people from organizations who are working with us on these important initiatives, and I will introduce them a little bit later as we get to the content that they'll be sharing. So I'm going to share my screen. I have a couple of slides. So let me know if you all can see that.
We can see them, although
Okay.
it's not in slideshow mode.
Yes, thank you. Is it now?
Now it is.
Okay,
Yeah.
perfect. Okay, great. So thanks again for having us. Many of you may have been online or maybe even in person in Washington, DC at the end of March, when we sort of officially announced this effort by Kaiser Permanente to focus on initiatives that build support for public health. To start off by stating the obvious, I think the last 3 years have been incredibly difficult for everybody. The pandemic was hard on public health. It was hard on healthcare. It was hard on communities. It was hard on pretty much every sector out there. And so as part of that kind of realization coming out of the pandemic, I think KP recognized that all the sectors have an important role to play in supporting public health and making sure that we have a robust public health ecosystem. Public health ecosystem to support equitable health outcomes in our communities, and also to be able to respond more effectively during public health emergencies. And so while I think there is a long list of potential challenges that public health is facing and that we could be kind of chipping away at, we already heard from Dr. Benjamin about some of the workforce efforts, which are really exciting. KP really wanted to narrow in on a set of initiatives where we felt like, as one of the largest health systems in the country and the largest integrated health system in the country, where we could have the greatest impact on some of these issues. And so over the last year, we've started to build out a portfolio of work that's focused on building support for public health. And it has 3 very specific focus areas to start. I'm going to spend a little bit of time sort of setting an overview of all 3 areas and then providing an update on the first bucket of work. And then I'm going to turn it over to my colleagues at CDC Foundation and AcademyHealth to go into more detail on the second and third bucket. And then hopefully we'll have plenty of time for questions and dialogue at the end. So to get us started, the first bucket, and the one that is probably the furthest along and that we started to build out the earliest, is an effort focused on building the connection between public health and healthcare. So the connectivity between these 2 sectors in support of public health and equitable community health outcomes. We recognize that KP, along with other major national healthcare organizations, have a lot of power and weight in our voice, and can be using that collective power to drive towards some policy actions that would support better integration between healthcare and public health, and a stronger public health system overall. So this work began probably over a year ago. Some of you, I think, were involved in some of that work. It started with a rapid evidence scan that really lifted up, I think it was probably over 100 evidence-based, evidence-informed policy actions to guide potential solutions that this group might be able to work on together. And from that initial list of about 100, we went through an extensive Delphi process, again, with many of you, to help us narrow that list to a much smaller, actionable set of priorities that we could start with over the coming years together. So again, our partner organizations in terms of the coalition that's going to be working on this project is the American Medical Association, the American Hospital Association, AHIP, the Alliance for Community Health Plans. And again, the idea is here that this is a healthcare coalition in support of public health. So these are the primary players that have been engaged in the process and coming out of the process of last year of setting these priorities. So after going through the Delphi process, this group landed on an initial set of 4 priority actions that they've agreed to advance together. And I'll share those priority actions in a little bit. But now the work really in front of us over the next couple of months is to really stand up that coalition, establish the sort of organizational and staffing structure for that coalition, and begin to do some of the policy and opportunity analysis needed to really kind of double click on each of the 4 priorities and figure out where the specific policy action potential is for this group. So that's the first bucket. I'll share the policy actions on the next slide. But before I do that, I just wanted to share the other 2 buckets that we've built out in the last couple of months. So the second one is focused on public health and CBO integration. So similar to this idea of building stronger connections between public health and healthcare, we want to figure out better ways to support stronger relationships and better coordination between public health and CBOs. So again, during the pandemic, I think we saw the critical role that CBOs play in community health. They're often working upstream on sort of social health needs and supporting our communities around some of the drivers of health, like housing, food security, job placement, those kinds of issues that only got worse and were harder to manage during the pandemic. So they're critical partners in this work. I think they served as sort of public health extenders in some cases during the pandemic. They were often supporting contact tracing efforts, vaccine outreach efforts. And so I think what we're trying to do with this middle bucket is really figure out where are the places where those relationship examples really excelled, and how can we lift up those best practices and share them more broadly so that we can develop these stronger relationships. And I think the challenge with this middle bucket is, unlike with healthcare that has sort of some organizing structures around it, CBOs are very unique, they're very independent, they're very diverse, they're so many of them in any given community, and they're not organized under a single structure. And then on the flip side, you have public health jurisdictions across a range of communities. They have different capacities, they have different sizes, they have different structures. And so coming up with a set of recommendations and a roadmap that is meaningful to the broad spectrum of CBOs and public health systems out there is the goal here. And then finally, the third bucket is focused on refreshing a public health services research agenda. So AcademyHealth is our partner in this work, and they are leading a process that they're going to describe here shortly around really figuring out where the focus needs to be over the next 10 years with regard to focusing the public health sort of research community and driving support of an investment in that set of research priorities. So those are the 3 buckets of work. I promised I would share the 4 priority areas. Again, if for anybody that was in DC or has sort of seen some of the press that's come out of this, you may be familiar with these, but this is where the coalition of healthcare stakeholders has decided to start in terms of the efforts that they're going to take on over the coming months and years to help support public health. So again, you can see it spans everything from really working to kind of formalize the relationship and the agreements between healthcare organizations and public health in any given community, and really getting clear about roles and responsibilities so that we're not trying to manage that part of things in the middle of a pandemic. Ensuring emergency preparedness is always on. Again, the thought here being that in the middle of a public health crisis is not the time that you want to be, trying to figure out your emergency preparedness plans and who's doing what. And then the second two are really focused, or the third and fourth are really focused on data. So there's, and I know there's a lot of actually parallel work going on in this space, modernizing public health data, building stronger data systems. The idea here is we really want to be coordinated with other efforts out there and make sure that we're advancing, accelerating anything else that's going on. So that'll be an important part of this work, is making sure that we're coordinated with other work that's happening. Advancing health equity by making sure that there's a national standard for stratifying public health and healthcare data, making sure that we have data available by race and ethnicity and that it's available in real time so that people can make meaningful decisions about what work needs to happen where and with whom. And then modernizing public health data systems and integrating an infectious disease surveillance system with interoperability as a sort of key tenet of that piece of work. So those are the 4 priority areas. I think, Angie, would it be best, do you think, if we go through all the presentation, or should I pause now and take questions on the first bucket, do you think?
Why don't we go through? If anybody has questions, maybe you can ask them in the chat and maybe Dana can answer it that way, or we can come back at the end just so that we remember them. But just want to make sure everybody has a chance. That's great.
Great. Thanks. So I'm going to now turn it over to Pam Roche from CDC Foundation. Pam is a senior health equity data analyst and part of the fierce team of partners over at CDC Foundation working on the initiative focused on integrating public health and CBOs. So Pam, I will turn it over to you.
Great, thank you. Can you all hear me? Okay, I see a couple of you shaking your head. Yes, okay, good. So I will dive into that second pillar or strategy that Dana just highlighted around strengthening the interface between CBOs and public health departments. So you can go to the next slide. Oh, this is a little bit about me. I am an epidemiologist at the CDC Foundation. My background, actually, I was a director of health equity and assessment research at a community-based research institute in Chicago that was based in the state's largest private safety net hospital system. So did some of their evaluation work and community health needs assessment and improvement planning work. So have some of that also connection and understanding of public health work within a healthcare setting that applies across these different pillars. So our portion, next slide, our portion of the project really aims to set up a series of national recommendations and an implementation roadmap on how to cultivate and build upon relationships between governmental public health and CBOs to better prepare and respond to future public health emergencies, but also really thinking about these relationships and recommendations as applying to routine public health practice as we pursue different initiatives and activities to achieve health equity. We also hope these recommendations lead to more effective relationships and partnerships that promote community-defined objectives and priorities, and really lead us towards shifting and sharing power with CBOs as a critical component of the public health infrastructure in ways that bring them to the table and create partnership to make decisions together about actions and strategies taken within community to pursue community well-being. So on our next slide, I highlight a series of activities that we'll be going through in this project. And I want to reiterate something that Dana highlighted. Our recommendations are intended to be actionable, feasible, and relevant across a broad range of contexts within the United States. And so in order to get us there, we have this series of activities that seek insights and feedback from a broad range of partners across the CBO and the public health landscape. So the first step in the process is our assessment phase that has two parts. First is an environmental scan or landscape review of the content and knowledge out there related to facilitating strong partnerships, which we actually have just completed. And we're in the process of beginning interviews with CBOs and health departments from across the country in order to understand if the findings from that content analysis resonate, and also explore deeper, more local and on the ground examples of facilitating effective partnerships, as we want to elevate those best practices as we move forward. Our next series of activities is we have a set of national partners, which I'll cover on the next slide. And I think many of you here are probably part of some of our national partner organizations that we will convene later this summer and probably into the early fall. And we're going to take the findings from this assessment phase and build some consensus around that initial set of recommendations and then implementation roadmap. And from those convenings, we will then move into a series of insight sessions. There we go, or the testing phase. So we're going to take those recommendations built through consensus sessions and take them on the road a little bit and do some focus groups, meet people where they're at, perhaps meet with this group again, and test these recommendations out, get some refinement and thoughts and feedback. And then next step will be the phase of finalizing those recommendations, hopefully getting those who went on this journey with us to endorse those recommendations as an agreement of the step forward for public health. And then the final phase is around disseminating that report, those recommendations in the new year, having a webinar put on. And so currently, I think if you click the animation highlights, we are in the interview phase, as I highlighted. And in the handout that you all received as part of the invite, you can see there are various ways to partner with us across these phases. So if you're interested, take a look at that. There's an email that you can contact and get it. We can infuse you along the way. So on the next slide, we just highlight briefly who's all engaged in this process, which is important to ensuring that these recommendations are actionable, they're feasible, they're relevant to CBOs and health departments. And so we have our core team at the foundation, at the CDC Foundation, in our Health Equity and Strategy office, but we also are contracting with a group called Human Impact Partners out of California, but they do national work and have done really innovative work in the space of partnerships with grassroots or community power building CBOs and health departments that have seen some really transformative changes to policies that can impact community well-being. We are also working internally with our own team in our response crisis and preparedness unit that worked with CBOs throughout the pandemic, and our communications team. And then here you can see the series of national partners that we're in the early talks with. Actually, we're not really in the early talks. We talked to most of these partners in the past couple months. And this is the group that we're bringing along this journey with us. So we are touching base with them on a regular basis. We're getting their thoughts. We're ensuring that how we're approaching the project makes sense to them and resonates with their membership. So that is our group of national partners. It's expanding a bit. Not quite everyone's listed there yet. And then finally, the last group of this work is, I think there's one more animation on this slide, is there's ways to collaborate. If you're a CBO, you represent health departments, you represent grassroots organizations, to collaborate across all of those phases that I just highlighted. And so we want to, there's not enough room for all the names that we hope to be engaging on this slide, but we want to highlight that that is a critical component to all of this work. I will stop there, and Dr. Lauren Smith, who's leading this work on our end, is on the line. If you'd like to add anything, Lauren, and then we can hand it back to Dina. Oh, I think I see Lauren's face. I think she's not, the mute is not working on her end. So we can hand it back to you, Dana, and on to the Academy Health team.
Okay, thank you. And if Lauren gets herself off mute, she should feel free to.
Yes, I was
Oh, there you are.
stuck on mute. I apologize. This is, I think Pam did a great job. I just wanted to take a moment to thank you at Kaiser Permanente for, connecting with us to participate in this work. We've gotten, I think, some really positive feedback and interest and engagement in participating in this work. There's, I think, a lot of interest. So it'd be interesting to hear what this group is going to share with us.
Great. Thank you, Dr. Smith. So before I introduce Dr. Lisa Simpson from Academy Health, I just wanted to acknowledge the question in the chat because it was an oversight in my comments when I was talking about the Healthcare Public Health Coalition. And it was a question about public health can engage in that body of work. And while the coalition sort of steering committee is structured in a way to include these national healthcare partners, there's very much an intention in the overall structure of the work in pulling in public health advisors, subject matter experts to support the development of the work, the policy priorities, and the overall sort of direction that the group heads in. So we've got an advisory council that will include public health organizations, sort of a more formal advisory council, and then technical advisors that we will very much be leaning on and relying on for the build out of the 4 policy areas. So if anybody is interested, as I mentioned, we're still sort of putting the details together in terms of the structure and the staffing of this. But if anybody is interested in being involved in, I think it's safe to say, any of these buckets of work, please speak up, raise your hand, let me know. And we're happy to sort of, we've got a kind of growing list of public health stakeholders that we will be circling back with as we get a little bit further along in standing up the actual coalition. So I just wanted to get to that one question since it was an oversight in what I had meant to say earlier. Okay, so with that, I will now turn it over to Dr. Lisa Simpson, who is president and CEO of Academy Health for over 10 years. She's a nationally recognized health policy researcher and pediatrician, and we are thrilled to have her and her team partnering with us on the public health research agenda. So Lisa, hopefully you're on and can get yourself off mute.
Right here.
Perfect.
No, great.
Oh.
Thank you. Yeah, and Angie, you can move ahead. Perfect. So I want to, this is Kate Papa is our partner in this, and we're going to be tag teaming this presentation. We're going to go pretty quickly. We tend to speak quickly anyway, because we really want to get to your questions and discussion. So as I'm talking, Kate's going to drop some questions to get you going in the chat. So let's go to the next slide. So first of all, in case you don't know who we are at Academy Health, we are the National Organization for Health Services Research and Policy, and our mission is to improve health and healthcare for all by advancing evidence to inform policy and practice. So being able to partner with Kaiser Permanente and with APHA, who is a partner in our work for this agenda, is right at our sweet spot, and we're very excited about the project. Next slide. Keep going. Perfect. So project highlights. I think we all know it's important, right? And the question is, how do we continue to learn from public health actions so we know where to invest and how much to invest, and how do we have the evidence for the public health investments impact on equity and outcomes and health. I've mentioned we're partnering with APHA on this, particularly because of the final phase is as you can see at the bottom of the slide, the advocacy for sustained investment in this agenda. Our approach, you'll see on the next slide, is very iterative. And we are going to be doing this agenda setting activity to really get to providing a roadmap of how the evidence needs to be generated for a reimagined public health system, and that gets to all of these goals. Next slide. So here is who is on our guiding council. We're going to our phase 2 of our project, and that is a broader stakeholder meeting. And I'm going to turn it over to tell you a little bit more about the approach and some early results from key informant interviews that Kate Papa will cover. Kate.
Hi, good afternoon, everyone. It's really lovely to be here and to see some faces I haven't seen for a long time. So can you hear me all right? Okay, it always throws me off when I see somebody else. Let's see, so I think, is it Dana who has the slides? Let's go down a couple. So the process Lisa talked about, we're gonna be doing this sort of stepwise process. We engaged our guiding council, the group Lisa just showed, do some literature review, and then meet with our deliberative dialogue happening in early June to start making sure that we're thinking about all the topics we want to be thinking about and having a broader stakeholder prioritization project over the summer. So if we can go to the next one, I think this is what Lisa mentioned, the one after that, we did a little bit of key informant interviews and literature review, and we asked folks, and thank you, Dana at KP for pressing us. The next slide here, we asked folks, why hasn't there been a sustained investment in the research agenda for public health? What we want to make sure we know why there hasn't been that to date, so that we can think of that from the beginning. So here are some of the responses we got from our key informants. If you see anything missing, please put it in the chat. We want to make sure that we're thinking about this right from the beginning. So some people said to us, it's not very sexy. People don't really want to do this kind of work. No one even knows it's out there, which we definitely hear that. Some people said, make sure you're asking really relevant questions that practitioners need answers to. And then, of course, we heard a lot about the chronic underfunding of the public health system overall, and how there's great competition for resources for all of us working on social determinants of health and other areas outside of healthcare to improve health and advance health equity. So I encourage you to please reach out to us or pop in the chat if there's anything we're missing here for lack of sustained investment. And then the next slide, Dana, is we asked, what conditions are needed to drive further investment, public and private investment, and an actionable research agenda. So this is what we heard again from our key informants. And in the literature, we heard a lot about trust, which probably is not surprising to anyone. We heard a lot about leadership. A lot of people said, this supply for demand that doesn't exist, there's not enough time in public health practice to know is there thirst for the evidence? Are public health practitioners and community-based organizations able to participate in this kind of research? Do they have the time? Do they have the skills? How can we boost the workforce? So great. What am I missing? Please, anyone, let us know what's missing here. A great piece that we also heard when we asked folks for sustained investment was that we perhaps did not engage communities enough in our previous work. So we're really focused right now on partnering with CDC Foundation and others on making sure that we engage communities. I love what Dr. Benjamin said about advancing health equity through strengthening public health capacity for community engagement. And we definitely want to engage the research community in that recommendation as well. Lisa, what did I miss?
No, that's great. Yeah, I see a couple questions coming in, so that's great. Vanessa, siloed funds, yep. And lack of value. Okay, great points and some thumbs ups on that. But please, importantly, this is not your only bite at the apple for working with us. You have my email on the Alliance group. I think everybody has access to those emails. I'm not sure, but if not, it's lisa.simpson@academyhealth.org. Love your input, your thoughts as we work over this for the remainder of this year. Great. Oh, thanks, Kate, for dropping it in. Dana, back to you.
Great. Thank you both. So at this point, we do have time to take some more questions. I've been trying to manage or monitor the chat a little bit, but please, maybe Angie, you can let me know if I've missed anything. And I'll just open it up to questions. And before I do, or as you're thinking, I also just wanted to acknowledge my colleague, Kendall Stagg, who I think is also on the phone, who's been my partner on the KP side, along with Dr. David Grossman, in sort of standing up this body of work. So just wanted to acknowledge him since he's also on, and he may chime in with thoughts and responses to questions as well. So
I'll come on camera for a second. I actually just put in the chat box questions that I have, Dana, not for you or the other presenters, but actual questions for the other participants on this call. Questions
Great.
about how they want to be informed. Whoops. Can you hear me? I have this down or up. How folks want to be informed about this work. If there's a particular piece of this work that they're especially interested in, want to be engaged, how do they want to be engaged? And in fact, I would invite anybody on the call, if you want to be added to one of our stakeholder mailing lists, by all means, feel free to type that into the chat box so that we can capture that and make sure that we do engage you in this process. As was discussed earlier, there is real intention, especially on the coalition work that is a healthcare industry coalition that will not be opened up to public health partners, to still have public health very much at the table every step of the way and really informing that work and participating in policy analysis, opportunity analysis, making sure that we don't have blind spots and getting their feedback and buy-in on what might be the most successful and helpful. So there's opportunity for engagement here, and we would certainly like to capture your information if that's something of interest to you.
thanks, Kendall. So any questions, any reactions to the questions Kendall put in the chat? Any questions for CDC Foundation or Academy Health?
And you all are welcome to raise hands. And Dana, I'm not sure if you want to still share screen or if you'd like us
Oh,
to.
yes,
see
thank
the
you
group.
for, yes, thanks for,
And you'll be able to see people raising their hands too.
yeah, great.
Great.
I would just jump in to answer one of Kendall's questions, or actually not, kind of build on it in terms of how would you like to be kept informed about the progress. I'm going to put Angie on the spot and say, you bring us together, we're happy to send updates to Angie for further distribution to this group. But I think importantly, and particularly for us on our agenda development, when we get to the point of having the agenda finalized, there's not only the component of trying to make it happen in terms of the advocacy for sustained funding, both public and private, but also socializing that out very broadly to public health stakeholders. And so we would love to work with all of your organizations when the agenda is finalized to, have links sent out to your members in your member newsletter, whatever, we'll be developing media toolkits. But you could really help us amplify that so folks are focused on priority questions. Those who are doing research, can actually focus on that, and public health leaders can, know that these are some of the areas that we're focused on. So thanks.
Yeah, and thanks, Lisa, for that. And along those lines, I think it's important to sort of acknowledge that this is really just a first step in this work. And what we've described today is the initial kind of foundation that's being laid for work to come. So this is going to take many years, and we're excited about sort of the work of the next couple of months. I hadn't even seen some of those key informant interview results, so that was really exciting and interesting to look at. But it's really setting us up for a body of work that's going to unfold over the coming years.
Great. I see Christina's hand is up.
Hello, everyone. My name's Dr. Christina Madison. I am the Public Information Officer and Chief Pharmacist for Wellness and Equity Alliance. So my question really is just more in relation of like communication and how we're communicating within this group, and then also how do we communicate sort of what this brain trust of amazing public health professionals does on an outward facing basis. So internal communications as far as external communications as well. And specifically in the area of some of these like more hot button issues that have come up lately. We just saw today that there is another judicial hearing being held about mifepristone and its ability to continue on the market, and what's going on with that, and reproductive health and body autonomy, and then also continuous attacks on trans youth and trans health within the LGBTQ space. And then also the new HON that was just released in right on time for Pride Month for the new increased risk of Mpox infection. So I'm just kind of wondering what this group is thinking about sort of internal communications as well as external communications for some of these more like on the spot quicker things versus sort of this amazing strategic approach that you guys have created regarding more of the infrastructure around public health and ways that we should continuously apply health equity to all of our foundational needs. So thank you so much. And I really appreciate everyone's time and attention, and really lovely to see all of these amazing faces and people that are just doing the good work. So thank you so much.
I actually think that's a question for Susan or Angie McGowan, not necessarily the leads of these three strategic initiatives. Great questions, but I'm not sure that's for us.
I think we're happy to think about how to keep lifting up issues with everyone. I actually, sorry, Kendall, was thinking it was more specifically how you were going to communicate kind of the lessons you had, which I know Dana already mentioned that there are ways also to kind of follow this along and, have a lot of emails, but certainly something that we are happy to, if there are topics we need to talk about at our Alliance meetings, we're always happy to share out updates. If there are things we need to work on together, I would say definitely bring those to us. You can always email us at alliance@apha.org. And we're happy to think about kind of who are those partners and how can we help to connect them, because certainly agree, the more we can all think about how to tackle these issues and deal with some of these thorny issues, the better if we do it together.
Hi, this is Susan, and I'm just going to add that there might be some issues that it's not appropriate for the Alliance to engage in, but there are almost all of those issues you mentioned and all the things we think about, APHA and our partners are engaging. So just making sure we're connected on the work of the individual organizations as well as the Alliance, I think will really help make sure we are talking with one voice when it comes to public health. That's the goal of the Alliance, but some of the hot button issues, it's a little bit harder to engage people quickly and really be on top of it. But if you want to talk further about how APHA can engage and can works with partners on those things, I'm happy to do that. I apologize, I'm walking uphill right now, so I'm a little bit out of breath.
Thanks, Susan. Other questions? I see Michael Berry's put a couple things. I'm not sure if there's anything you wanted to lift up to the group. Didn't want to put you on the spot, just didn't know if there were questions or if you were more providing information, which is great.
No, thanks, Angie. I'm just providing some information in response to the question about, what other resources might Kate be considered.
Great. Steve.
Great. One of the things that the Alliance is working on is the creation of a plan to support collaboration at the community level in public health, and with a particular focus on coalitions that are multi-sector and that feature resident engagement. And I'm wondering if the research agenda that you're looking at might be relevant, be focusing on issues that are relevant to that area of work.
Steve, great question, Stephen. Do you mean research around how to build coalitions? Like what makes for successful coalition building? Because there's a body of work there.
There's a lot of body of work there, but about perhaps coalition effectiveness and addressing specific social determinants of health.
Oh, very interesting. Yeah, great. Thank you.
Other questions? I know Kendall asked a number of them, just in terms of what they might want to know, how we might want to be informed. Are there ways to be added? Other thoughts you all have on also as an alliance, how we might be able to help to support. I know one of the suggestions was maybe the group can come back to us or share updates. I think that is definitely something we can do. But any other advice for the good of all, or things you'd like to make sure that we touch base on over the next months?
I do want to add from the governmental public health CBO partnership side, we will also be at NACHO 360 and at the AcademyHealth conference and at APHA doing panels and interactive sessions where we will iteratively share what we are finding and the directions we're going. So I would encourage you all to keep a lookout for that and join and share there, if not through other capacities as well. But for those of you on this call, that would be great to hear from you at those sessions as well.
Great. Anything else? I know we heard a lot today, so it was exciting to really hear about all this great work happening.
I will put my email in the chat just in case people have other thoughts after the call. And is it possible to get the chat transcript?
I will definitely send it to you. Yes.
Thank you.
And just for everyone, we'll also have recorded this session, and so we'll share it with people later. So if you have colleagues who weren't able to join, or if you want any of these resources, you can definitely get them later, and we're happy to share them. Okay, I don't see other questions. So with that, I know we're getting near the end of time. Thank you so much to all of our colleagues from Kaiser, CDC Foundation and AcademyHealth for sharing this with us. I know we really learned a lot from you and look forward to being a sounding board for you or helping as we can over the months to come. For everyone else on June 21st, our next Alliance meeting will actually have the COVID crisis group making a presentation. Mike Osterholm will be the presenter, talking about some of the lessons that they have from work that they originally started thinking about doing a commission on kind of learning from COVID, that they decided to transition into some reports and papers that they'll also share with us. So with that, thanks to everybody. Have an amazing next month. Thanks for all you do. And we will look forward to sharing this information with you. Thanks so much.
Thanks, everyone. Have a great day.